Hi everyone, hope you all are doing good. After a long gap, I have come back to the video for the same topic, depression. So, I was teaching depression in my school for since like 1 month. The chapter full was going on about the depression and the factors which is affecting the depression. So, I thought I will share the same thought process here as well. So, many people have messaged me personally and regarding the depression, and they wanted to know more about the depression. So what all the factors which affects the depression we will discuss today. So the vital part in here is the genetic factor, which plays a more important role in the depression. There are two types of depression: unipolar and bipolar. So the most common kind of depression which we see is the unipolar depression. So I will discuss once again about the symptoms of unipolar depression, which we need to know. The first, the most important is your appetite, loss of appetite, sleeplessness, lack of sleep or oversleep, overeating or lack of eating, loss of appetite, and once the activities which you were enjoyed, you will withdraw that activities, and you will be reluctant to do such things which you were enjoyed before. And socializing, you will be like you want to stay alone, you will be feel isolating yourself from the society, so you will keep yourself isolated, and no social gathering, no socializing with anyone. And suicidal thoughts, continuous to suicidal thoughts, thinking life is worthlessness, life it is not you will feel like your life is not worth for anyone and your presence doesn't matter for anyone. Such thoughts will come to your mind, and you will be like going deeper and deeper into the depressive state. And to overcome the situation, you have to have as per the severity of the case, you have to consult a therapy. If anyone or in your contacts is undergoing kind of depression, you have to suggest them, refer them, or being a bystander, take them to the therapist for a therapeutic setting. We will do the cognitive behavior therapy for the patient who is undergoing the unipolar depression. So we will collect all the details, all the factors which associates them for falling under the depression. So there are two factors which is triggering the patient to fall under depression. One aspect will be the socio-psychological aspect, and there are two factors associated with the unipolar depression. And for the patient, for any person to get a depressive state, there are two factors. One is socio-psychological factor, another one is genetic factors. So if there are cases of depression in your family, it no need to be your immediate family member like your parent or your close relative, the immediate contacts. No, it can be from your ancestors, from your great grandparents must be having any psychological problem like unipolar depression or any other kind of psychological problem. So here we are discussing only about the depression and the unipolar depression, so I will focus only on it. So if they must have had the depression, so there are chances for you to inherit it in your life, and the chances are more for you to get the unipolar depression. It can be vary. Genetic factors makes individuals more susceptible to stressful life events. For them, acquiring unipolar depression will be easy because they must be having a family history of unipolar depression. So even though it is from their great grandparent, it must have passed to multiple genes, and the patient who is having the disorder now have affected with the unipolar depression. So there is no any close contact or the immediate family member. It can be the ancestors, your forefathers, who must have had the genetic disorder of unipolar depression, can be able to inherit the disorder in you. So it has been passed through the bloodline. So for them, the psychosocial factor is, it will affect more easily. Soon the patient will face the depressive state more than a patient who is not, or more than a person who is not having a family history of depression. So even when a situation happen, two people are focusing it. Two people have observed the situation in a similar manner. But the patient, the person who is having the family history of depression, will acquire it more faster than the one who is not. So psychological factor and the genetic factors play hand in hand. They are hand in hand responsible for the unipolar depression. So we cannot avoid it, psychosocial factor only can affect the unipolar depression, or only the genetic factors, but genetic factors have little more weightage than the psychological factors for acquiring the unipolar depression. And the patient has to take CBT, cognitive behavior therapy, from the expert, from the specialist, from the therapist, and they have to frequently visit the therapist for getting the counseling sessions. So it can be like, so while we conduct the CBT, cognitive behavior therapy, we will understand, the therapist will understand the thought pattern which undergoing in the mind of the patient who is having the depression. So first we have to understand the thought process. What kind of thought process is going inside the mind of that patient? So we can be able to adapt the things, and that therapeutical process will happen easily. Next is challenging negative thoughts. Negative thoughts is the key for any psychological disorder. Whenever you fall for the negative thoughts, first it will start from yourself. When you feel you are worthless, or when you feel you are not worthless, the worthlessness is there are chances for you to adapt negative thoughts in your mind. So first you will think negative about yourself, because you are thinking, I am not worth for doing anything. At that moment, the small negative thought, it comes in your mind about yourself. Next, to the next person, you will the close contact with you, you will feel negative about them. Then your friends, or with the society, it goes on until you will feel the whole world is negative. So the negative thoughts inside your mind is making the whole scenario negative, and with so much of negativity and so much of negative thoughts in your mind, your chances are there for you to fall under depression. So as a therapist, it is our responsibility to motivate the patient, to bring up the positiveness in them, and to make them understand your life is worth, you are worth, and it is not worthlessness, you are worthless. So that worthlessness, we have to convert it into your worth, and that negative thoughts we have to get rid from the patient's mind. So we have to accept positivity and reject the negativity. Inhale positivity, exhale negativity. So so then we will do the behavioral activation in the patient. As I said to you before, when the patient undergoes depression, the things which they enjoyed before, the activities which they enjoyed before, they will reject it. So they will withdraw such activities. So being a therapist, what we do, we will just try to understand what all activities they were enjoying before, and we will tell the patient to do it. we will associate with them, we will be along with them, the therapist will be along with them, and we will make them engaged in the activity which gives them pleasure. So, and after that we will give some rewards also to the patient, and we will give some motivational quotes, we will motivate them, and we will give them the rewards makes anyone happy, and that will, they will accept it, and the thing, it is like a motivation also. So when we give the reward, the token of acceptance, they will be happy, and they will find more interesting the activity, more interesting, and they will involve more into it. Skill building. So next we will do the skill building in the patient. We will give some kind of relaxation techniques like meditation, or any problem solving games, or mind mapping, or assertiveness in training, and stress management strategies. There are many stress management strategies which we can imply for anyone. It is, we can be able to use, but for the person who is undergoing depression, it is very easy for them to give the stress management strategies. What all stress management as strategies are there? You can go for a walk, you can stand in front of the beach, you can enjoy, you can stare at the waves, you can have the cold breeze, you can go to the parks, you can talk to your friends, parents, your relatives, and whomever you feel like comfortable. You can play with your pets, you can garden, you can go and do the planting, gardening, you can play with your pets. Such stressful, you can listen to songs. If you're interested, you can listen to songs, you can read a book. Whichever things may give you pleasure, you can do it. And then we give some homework assignments to the patient who need a remedial solution at home also, and we will also advise the bystander who is bringing the patient to have an eye on the patient, and the skills and the assignments which we are giving, we will make a plan. Therapist, I make a plan, and I'll give to the patient who comes to me for the session. So once they do the homework assignments which the therapist had given, the next session when they comes, they will show their work. So we as a therapist, we have to give the positive remarks for that, and it will be added in their case file. In their case file, the behavior changes, the patterns, and the tracker, which the behavior tracker, we will follow up in the graphical representation. In that, we will show how much changes has been observed in the patient in this time limit. So once the patient have attained the tracker, we will give certain goals to them. So the goals has to be achieved. It can be achieved by certain accuracy. Out of 100, we will tell that the patient, after achieving the task, we will tell that the patient has achieved the task with 50% of accuracy. That is from the therapist side, I do, and from the patient side, it is they can also mention that I have recovered from this symptom, I have overcome this symptom and now I can be able to focus on my day-to-day life with the 40% accuracy. I achieved the goal. So that we have to monitor. The therapist have to monitor the progress in the patient. So till the case wind up or till the case terminated, we have to monitor the patient's development and progress. So if they want to have a contact with us for a long time, I have long-term patients who always keep on asking me doubts for their small things. I always welcome them. So the case is didn't close, the file is still open, and it doesn't mean that they are still undergoing the depression, but they are overcome it. But for the small remedial solutions, they used to contact me. So the main thing which you have to remember is to avoid the negative thoughts. Once you avoid the negative thoughts from your mind, you can be able to focus more on your day-to-day life with positive aspects, and the chances of getting depressed will be also less. Thank you so much. So it's actually depression is my favorite topic also, and it's a wide range of psychological problem which there are chances for all to get into it. Thank you so much, and have a great day.